This week on Healthy Living, we are looking at the causes of chronic kidney disease and how to protect yourself. And in Ghana, the rate of the disease is rising while patients cope with the high treatment costs. Plus, Liberia tackles drug abuse with the help of a former child soldier program. And finally, a medical breakthrough in New York as surgeons conduct the world's first eye transplant. That's in this edition of Healthy Living. Hello, I'm Lina Ahmedou. Thank you for joining us for another episode of Healthy Living. The numbers are staggering. An estimated 850 million people have kidney disease globally, and it accounts for more than 2.6 million deaths every year, according to the World Health Organization. Typically, people are born with two kidneys, which serve a critical function of cleansing the blood of toxins and transforming the waste into urine. In a lifetime, a person may lose one or both kidneys due to chronic kidney disease, but medical experts say it is possible to live a healthy life with one kidney. Kidney disease happens when the kidneys are damaged and cannot filter blood properly. The condition often goes undiagnosed until it reaches an advanced stage, often requiring a filtering treatment called dialysis and kidney transplants, which can be expensive or inaccessible to many. Data from WHO shows that the burden of kidney disease is particularly heavy in low and middle income countries. In Ghana, for instance, the northern region's Tamale Teaching Hospital has registered an increase in kidney-related cases. Alassane Abdul Washid reports.
Yahya Wanzam Adam is a specialist nurse at the Tamale Teaching Hospital in Ghana's northern region. He says his patients increasingly can't afford treatment for kidney-related ailments.
We started with 3 patients, and then as time goes on, the patient numbers keep increasing. At the moment, we have about 60 to 70 patients we are seeing who are on dialysis.
About 10% of the population globally is dealing with chronic kidney disease, according to the US-based National Kidney Foundation. In Ghana, the prevalence was about 13%, according to a 2018 study. Medical authorities in Ghana say the condition is due in part to high salt and sugar diet. The government-funded National Health Insurance Scheme, or NHIS, provides free healthcare service for some treatment and medication.
For dialysis to be taken by the National Health Insurance Authority is something that we've heard a lot of people who have commented on that, and internally we've also discussed it as staff of the National Health Insurance Authority.
The Tamale Teaching Hospital in northern Ghana treats patients from about 6 regions of the country. Yahya Wanzam Adam says most dialysis patients must receive the standard treatment, which is 3 times a week, but not many people can afford the treatments.
So most of them are doing twice in a week. Patient who is not able to come for dialysis for 1 week, if you see the patient, is so terrible. So terrible. It's life-threatening. The person can even die.
Abdul Latif says the NHIS covers treatment for first-time patients diagnosed with the disease, but says his outfit is talking about expanding coverage for long-term care in its annual review of covered illnesses and medications. But it is not just about coverage. There is also a shortage of dialysis machines.
Currently, 5 machines are functioning efficiently. Imagine we are dialyzing over 20 patients, and each session is taking about 4 hours.
Ghanaians are hoping the annual review will consider the concerns of families and patients suffering from acute renal failure and address both the need for extended coverage and the lack of dialysis machines.
Dr. Ibrahim Humaid is Professor of Medicine and Nephrology and Coordinator of the Kidney Center at the University of Maiduguri Teaching Hospital, HOD Medicine. He elaborates on the causes of kidney disease and how to take care of our kidneys.
We usually categorize patients with kidney disease, more especially chronic kidney disease, into 5 categories. The earliest category, which is stage 1. The 5 is the last stage, that is, the person have developed a stage that needs some form of replacement of the kidney function. You may not notice any symptom, and a symptom of unhealthy kidney usually follows either the person will notice some vomiting, which is usually early morning typically, or the person will notice some loss of appetite, the person will not take enough, or the person will have will start noticing some body swellings. The body will start swelling, right, starting from the face. We call it facial puffiness, or the body can swell generally, which is called generalized edema. Some of these individuals may have some early easy bleeds, they have some easy bruisability, they may have some pains in the epigastric region, which we call chest pain locally, or epigastric pain. These are the things that person will notice if he has kidney disease. What causes chronic kidney disease are these things I mentioned: hypertension, diabetes, some forms of infection to the kidneys and urinary tract, intake of traditional medication, intake of drugs over the counter, intake of some pain relieving drugs over the counter, use of mercury-containing drugs, intakes of some herbicides or insecticides that have been separated on diets, and some may have some genetic diseases like those that have sickle cell disease, we call sicklers. We are supposed to be checking our systems regularly. Even if a person is normal, he doesn't have anything, as long as he reaches a certain stage, certain age, like 40 years and above, he needs to be coming to hospital for regular checkups. So the steps to prevent it is take enough water, take adequate fluids. If your urine output is becoming colorful, is becoming amber, is becoming reddish, it means you are not taking enough fluids. Take enough fluids, enough water, so that the urine that persons are excreting should be as colorless as the water. This decreases chances of kidney disease tremendously. Intake of enough fluids, and then avoid drugs over the counter.
A 2023 report by the Global Action for Sustainable Development reveals that Liberia is losing an entire generation to drugs. According to the report, the capital Monrovia alone has more than 800 drug hubs and an estimated 100,000 drug users. An older generation of rehabilitated child soldiers have moved to join the fight against drugs using a behavioral therapy approach. Sinanu Todd reports from Monrovia, Liberia.
Along the Du River in Monrovia is a community of about 150 youth notorious for illicit drug use and sales. Those who live here call the area Abule City and say it is a haven for unemployed and frustrated comrades to find some peace. Benedict Souza is a resident and leader of the community. He says Liberia's unemployment has driven many youths to desperation. Many resort to drugs to cope.
Abule contains all of the category habits. We get liquor people there, we get drugs users there, we get cigarette users there, we get opium users there, we get cool users there. Everybody form part of our drugs.
Souza explains that while Liberia's unemployment has driven some youth into violent crime, communities like the Abule City provide a kind of security to those who live there.
We don't allow intruders, much like criminals, to come into our midst because you have the community dwellers, it's resting upon us. We agree. These are hard substances that we didn't supposed to do. But because of situations where it's providing situations, we do it. But now we're standing still. The community understands we are there doing it. And know that we are not bad people and will never be bad people.
A 2023 report by the Global Action for Sustainable Development says there are 866 ghettos like the Abule City in Liberia's capital alone. The report estimated that about 100,000 young people in Monrovia are involved in substance abuse. Advocates say Liberia's 14-year civil war in the 1990s and early 2000s bet this epidemic.
Since the end of the Civil War, the issue of drugs started in the country, and At first, it was actually being done by the warlords. They were given to the fighters in order to get them brave to the front line, because at that point they cannot be to their senses, so they get them brave to fight. Then after the war, it became a major business now in Liberia.
The Network for Empowerment Progressive Initiatives is a donor-funded nonprofit that uses trauma therapies and cognitive behavioral therapies, CBTs, to help more than 500 former child soldiers adapt into society after the Civil War.
In Zambia, authorities say breast cancer cases among young women is on the rise. Increasingly, the cases are diagnosed at an already advanced stage, complicating treatment and increasing the risk of fatality. Kati Short reports from Lusaka, Zambia.
Dr. Catherine Mwaba is the head of the Radiation and Clinical Oncology Unit at the Cancer Diseases Hospital in Lusaka, Zambia. Mwaba told VOA that her hospital, the only specialized cancer treatment center in the country, sees between 2,700 and 3,000 new cancer patients each year. Many patients must travel long distances to get treatment. Mwaba says she has noticed a disturbing trend among the hospital's breast cancer patients.
In our hospital, we see on average about 200 to 250 new breast cancer patients. What is particularly not noticeable among our patients is that they are of a young age, with an average age of your breast cancer patient about 45. That's really their reproductive age. The other one is that they get very aggressive types of breast cancer.
Mwaba says the rise in breast cancer cases among younger women could be due to many reasons, including urbanization, lack of regular physical exercise, a westernized diet, obesity, having children late, and not breastfeeding. She adds that inadequate health insurance and follow-up care and a failure to complete therapy also contribute to the increase. Yudi Favor Soko is a two-time cancer survivor. She had cancer of the lymph nodes when she was 23 and breast cancer in 2015, before her 50th birthday.
So I was dealing with a lot of emotions, psychosocial emotions, really. Not so much the physical parts, but the emotional and spiritual part was very difficult for me.
Wanting to help others tackle that mental element, Soko founded the Zambian Cancer Society, a non-profit aimed at improving the lives of the country's cancer patients. Recently, Zambia's Health Minister, Sylvia Masewo, announced plans to build 2 more cancer hospitals in the country to address the growing number of cases. For now, the wards at Zambia's Cancer Diseases Hospital are often filled to capacity, and patients may have to wait a long time before receiving potentially life-saving treatment.
Surgeons in the U.S. state of New York have performed the first ever whole eye transplant in a human being. The accomplishment has been hailed as a breakthrough, even though the patient has not regained sight in the eye. According to the surgical team at NYU Langone Health, the grafted eye has shown important signs of health in the 6 months since the surgery, which lasted 21 hours, including well-functioning blood vessels and promising looking retina. Presently, the transplanted eye is not communicating with the brain through the optic nerve. Until now, doctors have only been able to transplant the cornea, the clear front layer of the eye. The recipient of the eye is a 46-year-old male from Arkansas who survived an electrical accident that destroyed the left side of his face. Surgeons harvested adult stem cells from the donor's bone marrow and injected them in the optic nerve during the transplant, hoping they would replace damaged cells and protect the nerve. That's our show for today. For the latest news and health coverage, stay connected to Voice of America at voaafrica.com. You can follow me on X at Linoch Mudu. Until next time, stay well and strive to make every day a healthy day.